Hello, and thank you for participating in the Pierpont EMS Department Preceptor Training Program. The reason you are participating in this training program is due to our accreditation requirements. Now, you may have participated in a similar training, but some things have changed since that, so we need to continue updating our training. Thank you for choosing to participate as a preceptor for our EMS students. Your services provide a major component for the success of our EMS students. Participating in this, you're paying it forward for all those who helped you get to the point where you are at now. Hopefully you'll remember back on the time whenever you had a preceptor in your early EMS days. So take that into account for what the preceptor did good or did bad, so you can become a better preceptor than what they were for you. The object of this is to familiarize you with the preceptor and student roles and responsibilities, the training objectives, the completion requirements of minimum competencies, skills, and behaviors, evaluation tools used by the EMS program, criteria of evaluation for grading the students, contact information for us at the EMS department. Also, this will be covering preceptor training for the EMT and paramedic student. Preceptor responsibilities. You need to be a role model and lead by true example. Set a positive image for these students. Instill a sound foundation of knowledge and skills for the student. Supervise and educate the students based on your knowledge and experience in order for them to learn and practice adequate skills. Provide constructive feedback. Maintain a high level of moral and integrity when filling out these student evaluations. You need to be honest in evaluations. That's why they are required to be in a sealed envelope, because it will only better the education and experience for the paramedic and EMT students. Also, you need to make sure you're using good educational foundations. We're not at the point to be learning tricks and shortcuts. They need to understand the foundation and the elements of EMS in its whole entirety. The crew in which the EMS student is a part of must be a minimum of 3 persons. That includes the student, a preceptor, and an additional person. The preceptor must be working at their current level consistently for a minimum of 2 years. They must have been certified for a minimum of 2 years at the minimum skill. So this means that an paramedic who is brand new, who's been in EMS for 2 years, can only precept EMT students. If you've been a paramedic for at least 2 years, you may be a preceptor for a paramedic student. You must be in good standing within the EMS system and the respective agency in which you work for. A letter of preceptor approval may be required from the agency. Also, all this could change on special circumstances approved by the instructor. The role of the preceptor is to facilitate and oversee the student in conducting patient assessments and treatments. You need to ensure that the student provides care to the highest degree. Care should only be conducted by the book. We're not shortcutting. His goal is to create competency, understanding the fundamentals and the basics. Remember, the students are still in the learning and development stage. They will not be performing at your level. They are not experts. There are still circumstances and some knowledge in which they may not know at this point. A preceptor should only allow a student to perform a skill or administer a medication if they have been signed off on such. The student will have a skills evaluation and authorization form, as well as a medication administration form that shows what they are allowed to do, what skills they can do, what medications they can administer, and everything entailed. We'll go over the authorization forms of the EMS student. This is a medication administration form for the paramedic only. This form will have the check-off dates in which the student has been approved by the EMS department instructor on what medications they are allowed to give in the pre-hospital or clinical setting. This is the skills authorization form for the paramedic student. These are the skills that the student has been checked off on by an instructor, allowing them to conduct these interventions in the field. This is the skills and medication authorization form for the EMT. This is the skills and medications that the instructor has checked off the student to be able to perform. Now the student's role. The student shall arrive promptly. This is serving as a shift, just like a normal work schedule that they must arrive on time for. The student shall be dressed appropriately, wearing the PCTC polo, that black polo for paramedics only, appropriate pants and foot attire, and identification for their clinical setting. The student shall also maintain good personal hygiene. We want students to be dressed appropriately as they show up. They should be ready to start their shift in their appropriate attire as soon as they walk through the door. The student will be performing assessments and skills under the direct supervision of the preceptor. No freelancing. The student will represent Pierpont Community and Technical College to the highest degree. Any deviation from this must, absolutely required, to be reported on the student's evaluation forms. Once again, that is why the forms will be signed in a sealed envelope, so if you do have a negative remark about the student, it will be confidential. At the beginning of the shift, just review with the student the extent of the skills that they're going to practice. Look over their sheets and see where they're going to be able to fit in to helping you in conducting themselves throughout the shift. Discuss with them any areas they wish for assistance in and what areas they're covering in class. That will allow for some topics of discussion through the day, and know where the student may need help from you as the preceptor. Discuss with the students how they will fit in with your crew. Every crew and preceptor has their own pet peeves, so talk with the student up front about what your expectations are of them and how your calls are going to be conducted through the day. Give the student a tour of the shift site. Show them where the vending machines are, where the restrooms are, so they can make themselves at home. Familiarize the student with the apparatus. They should be there to do the daily checkoff on the apparatus. So review with them the location of the supplies and equipment. Make sure the student feel welcome. This can be a very anxious and intimidating thing for the student, so be sure just to make them feel welcome and comfortable as can be. During the shift, use every patient as an educational experience. No matter how trivial it is, there is a take-home point from every call. Remember, you are the expert in the student's eyes, so they expect to get something out of this. Use downtime proficiently. Now we have those days to where it's running all day long, and then there are those downtimes. Mentor the student in areas they wish for help or what they may be covering in class. As a preceptor, it is your job to act as a secondary instructor, so time is a crucial factor for the student. Don't let any of the time be wasted. At completion of the shift, students should report to the preceptor prior to leaving. It's responsibility of the preceptor to ensure the student fulfills their entire shift unless other arrangements have previously been made. The preceptor shall be responsible for filling out all evaluation forms. The student will have all those forms with them. If they do not have the forms, they're also available on our website. These are the requirements for completion of the paramedic only. As you can see, it's broken down by ages, chief complaints, the impressions, minimum skills and interventions, and how many team leads they are required. The student will know where they lie in correspondence to these minimums. So this is what they're going to be looking for, of what they need to finalize all of their clinicals. A paramedic team lead is considered that the paramedic student does a patient assessment and management of the student. That's giving an IV, IO, IM injections, putting them on the monitor, and this is for 911 calls only. not the convalescent granny totes. An EMT team lead is the assessment of management by the student. 2 assessments can be counted for 911 calls as long as there is time to do those. So if the patient is picked up a quarter mile from the hospital, there will not be time for 2 assessments to be conducted. So 1 assessment is initially at the pickup, and another assessment, if time allows, is prior to transfer of care of the patient. Also, if it is an interfacility transport or convalescent transport, those will count as 1 assessment, as a patient should be considered a stable patient. Feedback should be given to each and every student. If there needs to be correctional feedback, this needs to be done in private. You don't need to be giving feedback to a student trying to embarrass them in front of your coworkers. If you need to critique what you think that they need to be doing, please just do so in private. Positive reinforcement can be done in private or in front of others. Depending on the personality of the person receiving the reinforcement, you should be able to judge what venue would be best, whether in private or if they would like the feedback in a public setting. Student evaluation forms must be completed by the preceptor for all the students. This consists of the clinical evaluation form and the team leader evaluation. All these forms must be placed in a sealed envelope and given to the student to turn back into their instructor or mailed to the EMS department. This is the team lead evaluation form for the paramedics. This is completed every call the student serves as a team leader in the field. This will be the patient care report that the paramedic student uses to input all their information into FISDAP. This is required for every team lead performed in the field. Clinical evaluation form must be filled out for every student at every site. This is for EMT and paramedic. This is for hospital settings and ambulance settings. If at any point you have any questions or any issues arise, please contact us immediately at any of the contact information listed here. And once again, thank you for being part of our training program.